right. We have a special guest today. Um, just sent her an invite, so we'll see if it works the first time here. Hopefully. Uh, yep. Look at that. First go. Awesome. Can you hear me all right?
Yeah. Can you hear me?
Yes.
Okay.
First try. But sometimes it takes like 3 or 4 tries for it to connect, but so far so good today.
Oh, well.
Awesome. We'll give this just a couple, maybe a minute or two, just to let some more people kind of
Yeah.
flow in here.
Sure.
How's your day going?
Can't complain. We're halfway through the video.
Yeah, I'm no stranger to long days.
Yeah. We're not.
Yeah, I've been self-employed for too long. Like I don't really know what like a 8-hour day looks like. Not really sure how that works.
We can talk about some boundary
Yeah,
setting.
yeah. It's well, you would have talked to me 5 years ago, you would have probably lost your mind, or 10 years ago even. Man, a lot of trial by fire over the years, like learning from mistakes, as far as communicating with people. Yeah, for sure.
Yeah.
Um,
That's way to learn, though, I think. So.
yeah. Okay, so we'll get going. So before we jump into this, for those of you that are tuning in, you probably saw that I had made a story post talking about this live, going over some psychology considerations and psych considerations for our industry. All of you know how extremely important this topic is. I mean, we could probably talk about a lot of nuance here for hours and hours and hours. But before we get into any of that, could you introduce yourself, give you a little bit of background?
Yeah, for sure. So my name is Shannon, Dr. Cusack, but I don't like the formality. And I am a clinical psychologist. So got my PhD in clinical psychology, and I've trained and practiced in a lot of different settings. So everything from like trauma surgery, burn surgery units doing more acute care, veterans, VA hospitals. And then my kind of main focus have been on trauma or PTSD and substance use disorders.
Awesome. Yeah. So we met through a consultation, actually did a consultation recently, and I'm excited to have you on because this is something that I talk about a lot. I told you I have some background in psychology, nowhere near your level, so I'm really excited to have you. I have a lot of in the trenches psychological experience as far as working with these populations. So we in this space run into a couple different types of populations. Now, the primary thing that we'll run into in the competitive space is obviously a lot of neuroticism, a lot of obsessive compulsive disorder, a lot of these types of tendencies. Of course, there's nuance to that, and we run into issues because, of course, this idea of like tracking food and measuring all these variables and like these things, that all this like quantifiable data that we can utilize, even things like people tracking health markers and blood glucose and like tracking steps and all these things. So like we can literally take any of these data sets and just overemphasize them, become hyper vigilant about everything, right?
Right.
So that's where we start to run into issues with, of course, driving these stressors over and over again. So our efforts to track certain things become more of a deleterious, effort, I guess, if you will, over time. So when we start running into this type of thing, are there ways, I guess, because what I'm really trying to do with clients is first just like build self-awareness with a client, because I think that what happens a lot of the time is like we're on this autopilot, we're running off of emotion, right? There's not a lot of logical thinking going into what we're doing. Are there some initial conversations or identifying things that you that you think would be important to kind of like, hey, we have a problem and here's how we may recognize it?
So are you kind of thinking of the problem, someone being kind of adopting that black and white thinking, right? There's not room for flexibility in terms of their behaviors
Yep.
and tracking and logging and all of that.
Yep.
Yeah, for sure. And I think that's hard, right? Because you are someone that is like not prescribing that for them, but helping them with that, right? Like that's your expertise, and that's something that you're kind of suggesting that they do to some degree because theoretically they have these goals. And so I think that's a really can be awkward nuance for you, right? And so I feel for you as a coach in this space that, you know, isn't a trained therapist, but likely assumes that role at some times. I think that in my opinion, and this, you know, all depends on the client, right? Like everyone is so different, and so your approach is going to change. But you are, you know, theoretically someone that they respect, someone that they trust, someone that they look up to, right? And I think leveraging those like relationships that you've developed to be very direct and kind of point this out to them, because you're right, like it's really hard when we're in the trenches, if you will, of like wanting to track perfectly, wanting to hit our steps, wanting to train to the perfect RIR, things like that. It's really hard to snap out of it and see like, okay, you know, maybe this is getting a little too extreme, right? And so I think one, being direct, being honest with them, and of course, like a very nice, for lack of a better word, way. Like you are someone that appears to have people skills, and so I don't worry about that. Two, I think a conversation around values can always be really helpful. And I think this applies to like really any symptoms, any diagnoses in my world. You know, in your world, it can really be applied to like many different situations. I know one thing you mentioned is like you work with people on opposite ends of the spectrum. Some people are like obsessive about these things. Some don't even know what's going on in their own lives, right? And so bringing it back to values, right? These are questions that you can ask these people of like, you know, what are the actual values that are important to you in driving these goals? Like, why do you want to lose weight and be healthier, right? A lot of times it's going to be like, oh, I want to be around for my kids, or I want to be around with my family and be able to enjoy those things, right? And pulling on that, because it's like, if you're going to turn into someone that's engaging in this black and white, very extreme thinking, likely that's going to impact these other areas that are really important to you. And so how can we kind of pull on those, right, to show them that maybe we need to make some changes and incorporate some flexibility there.
Yeah. I think it's really interesting that you bring up being direct, because I have this in my head, like I have this kind of like system. I don't know if I want to call it a system, but these steps I like to take with people, because I like to meet people in the middle when possible, with, you know, in terms of like where they are in their life. And as far as like when I'm presenting a new plan to someone, like new goals and new steps, because sometimes if I just 180 someone's life right off the bat, of course that's not going to go over very well, right?
Right.
So I'm trying to meet people in the middle, but then there are also times where that doesn't work. You know, like it doesn't click, right? And I find that over the years I've had to be more and more direct with people sooner in that process rather than later, because it tends to it seems like if I set that precedent earlier on in our relationship, that I'm able to like dictate things better,
Yeah.
right? Rather than waiting 3 months and like I'm seeing all these red flags and I just keep like ignoring them, you know? And yeah, so I find that interesting. So is that something like in practice where, you know, you're doing an assessment with a new client, like they're coming in, you know, is this something where you like would ease into the process, or you're just coming right at them with, here's all the things?
No. Yeah, that's
Okay.
a good question. So like in my practice, right, we have like an intake. I mean, very similar to probably like how you operate, right? You need to get the information that's going to be helpful in terms of thinking about a treatment plan. And while you're getting the information, I think one of the key pieces is like developing that initial rapport, right? Like you have to develop a human to human relationship with this person if they're going to trust you and engage with you and try to make these behavior changes, right? So it's typically such that we have an intake, like start developing that rapport, get the information that I need, of course, and we're trained like in clinical skills, right, of how to get that information in a way that's like not off-putting or intrusive to a client. And then, right, it's like typically at the second session, and again, this is like very client dependent. Some people in the mental health space, like they want an answer, right? They want to hear like, oh, I think that this is what's going on. I think like this is what I would diagnose you with. And that's really helpful. Like that helps explain what they're going through. It helps explain their symptoms, and they can kind of identify with something. And other people, like diagnoses are terrifying. And I understand that side of things too, right? And so it is a fine line of like how much information I'm going to give them based on just kind of like how they're presenting interpersonally and what I think is going on. But it's certainly not like, you know, I log on or see someone in person, you know, pre-COVID days, like meet with them for 45 minutes and then be like, and this is everything that is going on with you that we can fix, right? Like that is, I don't think, a great approach for like any, definitely not a therapist, but I mean, probably not for you either, right? You need to build that like initial rapport and trust, I think. And so I do think, to your point, like it is kind of a process over time of like continuing to develop that. And, you know, if you're seeing these red flags for months on end and aren't saying anything, like that's just not helping the client either. You know, sure, it might hurt their feelings, but I think there's a way we can deliver that information that maybe is a little easier for them to digest. And in the end, like it's going to lead them to the behavior changes that they signed up to work with you for, right?
Yeah. I mean, I've changed my approach to that over the years because you mentioned trust. Like trust is, because essentially like what I'm doing and what people like myself are doing are, I don't want to use the word life coach, but I mean, we're coaching so much more than just nutrition, right?
Yeah.
We're coaching habits, we're coaching lifestyle, we're coaching nutrition training, supplementation, like all these things. But ultimately, in order to get the best result, it is this entirety, right? This whole entirety of your life. So when it comes to trust, that's one thing I always talk to clients about up front. And then I tell them, and this might take a few back and forths, it might take me learning more about the client, but I want them to trust me before they hire me, at least enough to where they're going to let me do my job. Because sometimes they come in they saw me on Instagram or they got a referral or something, which generally, if they've come to me, they already trust me to an extent, but that's not necessarily the truth. Sometimes people think that I just have an answer that someone else doesn't have, so they're going to hire me, even though they don't really trust anyone. And so I ask people, I'm like, hey, I need you to trust me before you send that money over to me to start working with me, at least enough to where we can start this process and I'm not fighting with you for the first half of your, coaching experience.
Right.
And that can be difficult. And I also like that you kind of like separated these approaches where sometimes that diagnosis, so for me it wouldn't be a diagnosis, it would be identifying problems kind of, right? And sometimes like me just giving that to them is a really great thing because it gives them some clarity and it gives them this ease, and they're like, not a lot of people like that uncertainty. So when they have something, they can kind of focus. Now, other people, that's a really bad way for me to go because I'm just giving them something to latch onto, and they start victimizing everything and they start blaming it.
Yeah. I mean, it's like that learned helplessness, right? If like you have a name to something, then you kind of, like you said, the victim, and I don't love the word victim, right? But they latch onto it, they identify with it. And to some degree, right, like behavior change is hard. We know that in any domain, if you will. And to some degree, like identifying with that diagnosis can almost be a way to like excuse them from making any hard changes, right? Like, oh, well, I have this, so, I'm not able to fix things, right? Or I'm not able to do what Austin's telling me because I'm like this,
right?
Even though it's like a treatable condition. And so that's where I think it's like knowing the client, which is hard, right? I mean, you don't have a lot of exposure to them before you have these initial conversations. And to some degree, it is like a risk deciding like, how am I going to present this information? And that being said, I think as therapists, as coaches, like as people on this world, being okay with the fact that like not everyone's going to love you or like you, right? I think that is an important thing to consider as well.
Yeah, I think over the years, being liked is important, but being respected is more important. That you did what you were supposed to do and that you were honest. I think
Yeah.
that's something I value a little bit more than being liked. I want to be liked. I don't want people to not like me, but as far as in my space or whatever. But at the same time, that's not my first priority.
Right. And I think that you would be as good at what you do if that was your first priority, right? I mean,
yeah,
hard conversations. You wouldn't tell people like, hey, probably cut out the alcohol because your gut is not doing well on it. Things like that people don't necessarily want to hear because it's hard.
Right.
Changes are hard. So
yeah, and sometimes my breakthroughs with people, people that have worked with prior coaches and stuff, the way that I'm breaking through is simply just because I'm identifying the problem and approaching and being honest with them a little bit better than the last person.
Yeah.
That's where I'm breaking through where someone else isn't.
Right.
Or using a different approach to kind of like verbalize that to them. But when kind of rewind just slightly, when we were talking about this identifying with problems and that's they're using that as an excuse to not make the change.
Yeah.
Can we elaborate that? Is there anything else we can kind of say about that would be helpful to people? Because I think that we run into that so much in this space too, in the mental health field for sure, but even in the physiological health field, because they're like, hey, I have, whatever XYZ condition.
Mm-hmm.
And you see this in Gen Pop a lot, but you also see it in the competitive space. In Gen Pop, they're like, well, I have this, so I can't work out, right?
Right.
Or I have this, so I can't do this. I can't whatever.
Right.
But then you see other people that do things against all odds, and they never make excuses. So are there any maybe tips or things that we can do there that might be helpful?
Yeah. I mean, I think the first tip or kind of way to approach it is like validating, right? And so it can be really easy, I think, for these types of clients to feel like they're not being heard or like they're, what they're experiencing physical or mental health wise is being invalidated, right? Because it is probably true that they're in a lot of pain, emotional, physical, whatever it might be, and have these diagnoses, right? And so we don't want to go in being like, just because you have this doesn't mean you can't do all of these things. Like that's not going to make someone feel great, right? So that gets back to that point of like rapport and trust and person to person kind of relationship building. And, I think there are a number of ways you could approach this, and I'll kind of go back to the values-based thing and an approach that's called motivational interviewing. I don't know if you're familiar with, but essentially like a really helpful kind of part of that approach is pointing out this discrepancy, right? So theoretically you have a client that's coming to you with a certain goal, right? And they're like, I don't know, what is like an example of someone that you've maybe worked with that held on to their diagnosis?
So we would use like a functional health type of client. So someone that has, let's say, some type of hormonal downregulation, hormonal ailment that is causing their energy to be low, right? So they feel shitty,
right.
for lack of better words. So that would be a common one.
Okay. And so they come to you saying like, I want to feel better. I want to have higher levels of energy.
Right. And they want to obviously function better, but anytime that they're unwilling to change something, they fall back on the fact that they are unmotivated, don't feel good,
right,
etc.
Right. I see what you're saying. And so I think one approach is like that can be super powerful is pointing out this discrepancy of like okay, like you're telling me you want to feel better, you want to make these changes, you want to have more energy, and yet your behavior is such that you actually aren't doing any of the things that I'm asking you to do to get there. Like, tell me what's going on here, right? So pointing out that discrepancy, I think, can be really powerful for people because while they're doing it and theoretically like consciously doing it, I think it's hard to hear coming from someone that they like are working with, that they trust, right? That like they think is going to be helpful in the situation. And they're going to be like, oh shit, like he's kind of right. Like what is this discrepancy, right? And so that's one kind of approach is like, again, you came to me with these goals and yet your behaviors like aren't really tracking. What can we do, right, to kind of get you in line? Or, is this just not the right time right now? Things like that. Like explore that with them, right? Don't pose it and then be like, you know, rude about it, if you will.
Right.
Yeah, I think further exploration too, and again, like this is hard because I'm coming from, well, I am a therapist, and so that's my point of view, right? You aren't a therapist, and so there is like a boundary, I think, for yourself and for the client. And so perhaps some of the things that like I would do don't necessarily translate, but I think to some degree you can further explore like why is that diagnosis or why is that problem, for lack of a better word, like so important to your identity? Like what's the kind of core belief under that? And what I mean by that is like, what are they worried about happening if they actually tried to change? And I wonder for a lot of these people if they're like hesitant to try these behaviors because they're worried that they'll fail at them, right? Or they're worried that it won't work and then what am I going to do? Like I'm screwed forever, right? And so they're hesitant to try because they have these underlying beliefs about what is going to happen and what that means about them or what that means about their diagnosis. Does that make sense?
Yeah, and that is one that I have preached for so long, and the fact that they are afraid to change because most of the things that I'm dealing with are their health issues, yes, but a lot of it is induced by lifestyle.
Yeah.
Right. So they're afraid to change their lifestyle because they identify with being a competitor or being a power lifter, like a power lifter or bodybuilder or bikini competitor or whatever it is, or they identify with having like abs or like anything. It can be anything, right? And so if they think that this behavior change threatens that, they're not going to do it. But in reality, if they continue doing the bad things that they're doing, they're not going to be able to maintain that identity anyhow. So like the only way to maintain it is to fix
right
it.
And that's like really hard to believe or accept, right? In terms of like thinking about the long-term repercussions of not changing. Humans are bad at that. It's a lot easier to focus on the short term, right? And I think, I don't know that it's like your job necessarily to do this with clients, but one thing that's coming to my mind in the same situation is like exploring why that's such a big part of their identity, right? And so, why do they feel like they need to have abs? Is that something that they think of as a condition of worth, right? Of like, I'm only a worthy human and people are only gonna respect and like me if I have abs, or like, is it, I mean, there's so many different underlying, like what we call core beliefs that could be the reason they're holding on to that so tightly and so resistant to changing. And so I think, simple questions, if you wanted to like delve into that with clients, is just like, okay, and what do you like, why is that so important to you? And what is like the worst thing that would happen if you didn't have abs or like you didn't compete this I'm not a bodybuilder clearly, but like compete in this cycle or whatever you all call them. So some like light exploration, but again, there needs to be a line for you, like to protect your own sanity and mental health and the client of like, you're not doing the work of like figuring out someone's core beliefs and trying to change them and how did they get there and like things like that,
Right. Yeah. And I'm not at all afraid to refer people out. I do all the time. So there's, it's it's fine. I'm not delusional in the sense that I think that I should be dealing with that on every level. But I, I would like to have, like, even there's some of my clients probably even listening to this. So, you know, I think this is a helpful thing for coaches to hear, but also people maybe seeking coaching to hear.
Yeah, 100%.
That's kind of my goal. But there's a couple little things that you mentioned that I wanted to touch on. One was I love the fact that you talked about what's the worst thing that can happen, right? Um, Social media is very difficult in this sense because a lot of these people maybe have their own coaching business or they have their own identity or of some type, and maybe there's a monetary value there potentially. And so they're afraid if they don't have this look or whatever it might be, that can be an issue. And I think that what they also don't realize is there's another subset of people that they could help by just talking, maybe being transparent about the things that they're dealing with. And, so I'll give you a great example. I had a client, this was a few years ago. She had some functional health issues. We kind of worked through them. She was very afraid to let go. And I come to find out it's mainly because she's like, I'm afraid I'm going to lose my business, my coaching business, if I'm not like, super lean all the time and I can't post these pictures all the time. I said, hey, let me give you an alternative point of view. Like, what if you talked to women about realistic expectations when you're not competing and what like an off-season competitor might look like and how to maintain your health between competitions, because she was a competitor.
Okay.
And so she did all this and eventually, and she came back and actually said her business had flourished because she was so honest and transparent. I'm like, now you're actually helping people.
Right. And like,
You know?
that's the thing. It's like, and this is a good parallel. Well, obviously, like aesthetics matter a lot less, I think, for therapy, but the idea being like coaches in your space, therapists in my space, like we are people, like, and I think that the majority of people looking to hire a coach and or a therapist want to work with someone who is like an actual human being and also has lived experiences that maybe are hard that they've had to navigate, because that makes them a better coach, that makes them a better therapist, right? And so I totally agree, like, letting go of that maybe aesthetic part of her identity and embracing like the hard shit that she went through as part of her coaching identity is super helpful. Like personally, and again, like I'm not a competitor, I'm not a bodybuilder, but like that would really resonate a lot more with me than someone who was like just posting their six pack, every other day. Because I'm like, well, that's not realistic either.
It would be an easy example would be if you are a therapist working in the field of disordered eating, if you have recovered from an eating disorder yourself, I'm probably going to be more inclined to listen to that person, and that they have their clinical education, but they also have real lived it, So 100%, I think that that's super important. And the second thing that you had mentioned, and I kind of laughed a little bit, was that human beings are really terrible at foresight and looking ahead. Oh my God. So this is, I always tell people that, especially the coaches that I work with, that I'm, helping them with their coaching education, that this is chess, not checkers. You know what I mean? Like when we're making moves, we should always be thinking a few moves ahead, because, it's like a very easy example is weight loss. The statistics on weight loss are pretty decent as far as people being able to lose weight, but the statistics on weight loss retention are really, really, really bad, like horribly bad. And a lot of weight regain actually is more than they lost initially. Right. So, and then people continue to go through the cycle and grab for new diets or whatever. So foresight is a huge issue that coaches deal with all the time. And this is with Gen Pop people trying to lose weight. This is with competitors, like I'm like, hey, do you want to compete once? Because I can just push you to the extreme and just ruin your body and you'll never be able to compete again. Or do you want to compete for 10 years?
Right.
So or, and that's like how I conduct this prep or how long in between the preps, like all those things matter for this person's health. But coaches have their work cut out for them when it comes to trying to get people to look at that big picture. So is there anything that we can expand on there potentially?
Yeah, that is a really hard question. And if I had like the secret answer, I would probably be a really I would just like
Tell me,
sell
can we sell it?
Yeah, seriously. I'll give you a small percentage since, you introduced me to the world here. Thinking about how to get clients to see the big picture. I think it needs, so again, like I think that ultimate values and ultimate goals are really important here, right? And especially like you mentioned, I think the competitor example is a good one of like, do you want to see really great results and compete one time and then like never be able to compete again, versus like, do you maybe want to is it like someone would take a break now and like fix these things and then be able to compete more down the line? Is that kind of how
Yeah, 100%.
Yeah. And so I think it's like you're going to be constantly fighting against this like immediate gratification. That is just the way our world is set up right now, right? Like, I mean, I don't want to sound like a boomer, like I'm not that old, but like we really do like have our phones at our fingertips. Like we can truly get essentially anything, information, products, whatever, in such a quick amount of time that like I don't know that you're ever going to be able to like change that the reinforcement that a client has gotten from this like immediate gratification part of our environment, right? And so I think it will take a lot of work. And how I would approach that is, again, sound like a broken record, but like going back to these values and ultimate goals of like, you say this is important to you, you enjoy competing, you value this because X, Y, and Z reasons. And if we do these behaviors right now, like you're not going to have that. And what is that going to be like for you, right? What's more uncomfortable, like never competing again or taking a break right now for a temporary period of time?
Right.
And walk through that with them, right? I think, like, again, this is like very much a process and something that both the coach and client are engaged in versus like a one-way communication type thing. Like these are questions that I'm posing, not like, statements that you would be saying to them. It's really like an exploration type thing, I would say.
Yeah, I like that. And that's really what I tend to do with people is I ask them questions because it provokes thought, It's
100%.
like, well, because if I just make a statement that doesn't really provoke any thought with the client. So, if I'm something like, I understand that, this situation's difficult, whatever, I can kind of identify the fact that it is difficult. I get that.
Validating, yep.
However, and, where do you want to be in 2 years, a year, where, like what ultimately, and a lot of time they've probably not thought about it. So maybe that's even the first part of it is they like they've not even gotten past right now. So, we can kind of open that box up a little bit and then getting them to think like that. And it does take a lot of work. It's a really awesome thing when people finally start to do it. And because then I can, makes my job way easier.
For sure.
But it's a lot easier thing to do when everything's going right. It's a difficult thing to do when people are struggling with functional health issues or something went wrong or they got hurt or whatever. Then it's a lot more difficult to do it.
Right.
That's where it becomes difficult.
And I mean, that's exactly to my point. It's like if things are going right and they're seeing progress, like they're getting that immediate gratification. Like, of course, they're going to be able to be like, yeah, this is great long term as well. Because like I'm seeing positive things happen now anyway, and I am fine with it,
Yeah. Yep. I think and I've even changed my view on that a little bit over time, in that I think that some immediate gratifications are a really helpful thing with coaching buy-in. And I'm sure in therapy, it's probably a helpful thing too. Like if you get a new client that comes in and that, hey, this is going to be a process, but if I can send them out the door in the second session with some really helpful tips that they can they can digest and do right now, I'm sure that your buy-in from the client is going to be way better, you know. So I'm doing the same thing with coaching. You know, I'm like, hey, yeah, this isn't going to get us to our ultimate goal, but if I can boost your dopamine levels a little bit and kind of get you bought into this process and get you motivated, then let's do it.
And I think like it's immediate gratification in terms of like they're maybe going to see like a small positive change. I think there's another layer of like some people, a lot of people are problem solvers. I assume, you know, kind of the neurotic type A people that you described that like love to track and log, like they love to solve a problem by doing. And I myself am one of those people. And so if you give them like a few things that they can actually do, they're gonna be like, yeah, I'm like solving this problem. Like I'm working towards it instead of just like sitting in this like shit space that I'm in. And relatedly, right, there's like low hanging fruit, if we want to call it that. You know, they're being active, they're doing the things, and they're building self-efficacy, right, which is really important, and gets back to those kind of like core beliefs, right? If they're like accomplishing the few small things that you give them in, you know, the first or second week that you're working with them, they're building that self-efficacy, they're building the beliefs of like, okay, I can do this, like I am successful, right? And that only helps them want to try the harder things that you then recommend later, right? They're not going back to like our earlier part of this conversation, like they're not going to be as scared to try new things because they've built that self-efficacy and confidence in themselves to be able to like make these changes that are hard.
Yeah, I love that. I think this is going to be really helpful to people. So there's just one other thing for the sake of people's short attention spans. We won't drag this out for too much longer. But there's just one other thing I wanted to mention or touch on a little bit, and that is the side of the opposite of the neurotic people, the person that walks in off the street looking for, you know, looking for coaching, looking for help of any kind. Do you think that with a person that lacks this, that's very emotionally driven, you know, they're the person that's probably grabbed the fad diets for a lot of years, they've done a lot of yo-yo dieting and stuff like that. Do you think that building that self-awareness is a pretty similar process to the more neurotic person? Because they both lack awareness. It's just the fact that, and both of them are unwilling to give up their habits. You know what I mean? Like there's really a lot of overlap there.
For sure. Yeah. I think, yes, there is a lot of overlap, right? They're kind of extremes on a spectrum. We could view them as. One thing I would say in terms of like self-awareness, I think it's a very similar type of like process, if you will. I think one thing that you could hit on with like these people is really digging into like, what have you tried in the past and why didn't it work, right? And you'll get a lot of information from that of like, are they, you know, where's their kind of like locus of attribution? Are they blaming like only external factors for like why these things didn't work? Or are they willing to take some of that responsibility and be like, okay, yeah, maybe like I only logged my food from like 8 a.m. to 6 p.m., but like, you know, I love an evening snack that wasn't in my MyFitnessPal, things like that, right? Like are willing to own up to it. And then I think that gives you a good sense of like, where are they right now when they're coming to you? And can help kind of guide, like, do they have like any self-awareness and like willingness to accept this responsibility, or am I really starting exactly like where am I going to start? I think could be a good gauge. The other thing I'll say, if you're thinking about, I think like you call them gen pop people, right? Is like if they're coming to you, for example, for weight loss, it's like the self-awareness into their behaviors and what they're doing. But it also could just be like, and so in therapy, like we talk about like awareness deficits versus like skill deficits, right? So if you think about someone with social anxiety, is it such that, you know, they're just like anxious about what people are thinking about them, which is like what social anxiety is? Or is it that, and they don't have the skills to like know how to act in social situations, right? So there's a skills deficit there and some anxiety. And so like with these people, thinking through like, okay, are you just not self-aware of like what's contributing to your weight gain or health problems or whatever you're trying to work on? Or is it that you're not aware of how these things are related and don't have the knowledge or skills to be able to like change them, right? And I
Yeah.
think coaching can be obviously helpful on both fronts. I think it's just a matter of like knowing where that person is at and not getting caught up of like they're not willing to, you know, be self-aware and
Should lose. There you go.
not leaning too hard on that, and also recognizing that like maybe it truly is like a skills and knowledge deficit as well.
Perfect. Yeah, I think that's great. I think that I tell all the coaches I mentor, I'm like, assume people know nothing
Yeah.
when they come in. Blank slate. Assume they know nothing. They can prove you wrong. That's great, but unless they're super experienced, and even a lot of the experienced people, they could have been doing things wrong for a really long time. You know what I mean? Like, I'm like, experience, just assume that they are a blank slate, and then you get to learn from there, because sometimes and that's why, like, I think coaching people in a way that, like, I always call it like thinking out loud. When I'm giving them an instruction, I'm putting kind of at least a little tidbit as to why. This is my thought.
Yeah.
This is maybe what will happen next, giving a little bit of foresight there. And it makes the process so much easier. They have less questions because they know what's going on. Yeah. They're not just wondering all the time, like where we're moving, like what we're moving towards, or why we're doing something. So I've literally had people be like, hey, I didn't work with this coach because I literally never had a clue as to why we were doing anything.
Yep. I mean, and I think like especially, you know, when it comes to like changing hard behaviors, right? Again, it goes back to those values and goals of like the why is so important from your end of like, this is why we're doing it, because that's going to get the buy-in that like maps onto like, oh yeah, this is important to me. This is what I want to reach. And Austin is telling me that these things are going to get me towards that goal for this reason. Of course, I'm going to do them. I mean,
Yes.
not everyone says of course initially, but you get what I'm saying.
Sure,
right?
sure. Yeah. And then lastly, just get a cat and you'll be good. Cool. So I really appreciate all the help today. I think that this is going to be super helpful for people. So I'm just going to repost it on my page. So if anyone wants to go back and watch it, if you came in late or didn't get to see all of it, feel free.
Yeah.
And what area are you in again? If anyone's maybe in your area and wants to seek any services?
Yeah, based in Richmond, Virginia. And I mean, with the advent, right, of telehealth, and one positive thing, I guess, coming out of the pandemic is like, can see people, typically see people across state lines. And if not, like happy to help find, you know, referrals for people too. Cause I know a big burden and people seeking care is like just not being able to find someone and, or having trudge through like all the options, and obviously I'm in this space and happy to help. So yeah, and so much we could talk about, I think, with like mental health in this space. So happy to continue any future conversations as well.
Awesome. Well, I really appreciate it. I hope you have a great rest of your day. Thank you everyone for tuning in, and we'll talk to you all again soon.
Great. Bye.
Thank you.